So welcome, everybody, to putting health at the heart of climate change. So there's been a lot of discussion this week about climate change, and we're really happy to spend some time focusing on health impacts. So we're very fortunate this morning to have Dr. Ahmed Ogwell Ouma here with us. He is the director of the Africa CDC, and he's going to share some brief introductory remarks to frame the issue before we get started. So if I may turn it over to you, Dr. Ahmed.
No, thanks, and a good, I think it's still afternoon. You never know with the jet lag related problems, morning can look like evening. But welcome and thank you everyone for coming. Mine is very simple, and let me start with the reality of any sector that fails, it becomes a health problem. It doesn't matter which sector it is, whether it is politicians or the folks who help us with keeping our spaces clean. Any sector that fails, it becomes a health problem. Many sectors have failed over time, and that's why we have climate change now becoming a real challenge to not just prevention, but also trying to respond to health problems across the world. And I'll give you a few examples with the situation on the continent of Africa. Today, we have one of the most invasive cholera outbreaks in the southern part of Africa, particularly in Malawi. Many of us have forgotten that there was a hurricane a year back. There was a tropical storm 6 months later, and that was the genesis of the cholera outbreak, and it has never gone away. But because we've been so focused on other things, nobody has been watching the numbers. Today, literally the whole of Malawi is a crisis region when it comes to cholera. Second is when you look at the small island states that are surrounding the continent of Africa, beautiful Seychelles, Mauritius, Cape Verde, Sao Tome, they are as close as it gets to showing us how bad climate change is because of the rising seawater, and also because of the changing climate that results in diseases they had not experienced before. An island supposedly is easy to control things coming in. But today, with all the travel that we do, when it has come in and you don't have the infrastructure to look after it, it becomes a huge problem. These small island states have, for a long time, been battling with NCDs largely. But today, communicable diseases are re-emerging on the islands, all because of climate change. Now, we in the public health space, we have to intrude into all other spaces so that the failure of others does not become our problem. We will be accused of stepping on people's toes and walking into areas that are not our jurisdiction, but if we don't do it, then we'll have a lot more work to do. I'm happier debating jurisdiction when there is no outbreak rather than debating jurisdiction when there is an outbreak. So the conversation we are having here today, let us walk into those spaces where there may be failure or where there has been failure so that we can work together to fix the issues in that particular sector. In this situation, it is climate, and we reduce exposure for our populations to preventable illnesses and health emergencies. If any sector fails, it becomes a public health problem. Thank you.
Well done. Thank you. So this is the challenge that we face, and we're going to spend some time walking through it. Let me just give you a sense of what today's going to look like. First, though, I've been asked to remind you that if you're on social media channels, it's #WEF2023. So I'm Cheryl Moore. I'm the head of research programs at Wellcome. We have 4 areas, one of which is climate and health that we're focusing on over the next 10 years. So we bring an incredible interest in this particular topic. So today we have a fantastic panel. The run of show is that we're going to hear from each of the panelists a bit. Then we'll go into a period for some questions at the very end. Okay, so briefly introducing our panel. I have to my left Catherine Russell, who's the Executive Director of UNICEF. UNICEF is tackling the impacts of the intersecting crises on young people, of which climate is certainly one. So we'll hear from Kathy in just a moment. Next, we have Victor Dzau, who is president of the National Academy of Medicine. The National Academy has been leading a number of important collaborative projects in the climate and health space. Welcome.
Thank you.
Vanessa Kerry is co-founder and CEO of Seed Global Health, which invests in health and the health workforce, including how to prepare for the shocks that climate change is bringing. Welcome, Vanessa. And last we have Paul Hudson, CEO of Sanofi. Sanofi has very clearly outlined its commitment to sustainability and social responsibility as part of its long-term strategy. So you can see that we have a diversity of perspectives. I'm really looking forward to this conversation. So first, a few introductory comments about what we're looking at. The climate crisis is very clearly a health crisis. And we need to put health at the forefront if we're going to make wise decisions. Since we were last here in Davos 6 months ago, we've had significant climate events. And they've shown people more broadly that rapid action on climate change is necessary if we're going to protect human health. So the most recent IPCC report from November, the Intergovernmental Panel on Climate Change, talks about increases in climate-related infectious diseases, as we just heard, premature deaths, whether due to air pollution or excess heat or other sources, food scarcity, including malnutrition of all types, and increasing threats to mental health and well-being as a result of climate change. The Lancet Countdown recently reported that health-related deaths in the most vulnerable, which they define as babies and the elderly, increased by almost 70% over the last 4 years, compared with the 4 years beginning in 2000, over 70%. So that's why we at Wellcome have made climate and health one of the 4 pillars of our strategy. There is time, though, if we act now to protect human health. So, for example, there's a new analysis that is soon to be published, the first of its kind, that suggests that if England and Wales were to meet their greenhouse gas emissions targets, it would save over 2 million life years between now and 2050. We just have to do what we said we were going to do. We heard from John Kerry yesterday that there are a number of opportunities for us to double down and make sure we meet those targets. So COP at this year's meeting has set up a new pavilion focused exclusively on health, which was opened by the Director General of WHO, underscoring the importance of health. And we heard a lot of conversations about health that we hadn't in the past when we were talking about climate change. So the potential is huge to promote health, to have co-benefits for changes that improve the climate and also improve health, if we focus on that in the development of adaptations and mitigations as we plan them. So today in this panel, we're going to focus on how we move forward, addressing solutions to help us respond to the impacts of climate change on health, and the role that different stakeholders can play and should play. So, turning to the panel, Victor, let's start with you. So you've talked a lot about the importance of bringing together different disciplines to address the climate change and health intersection. What cross-sectoral developments have you learned about that you're really excited to share?
Well, thank you very much. This indeed is a really important topic. When people think about climate, they think about environment and future generations. But people are suffering and dying right now.
Yes.
I think the main message, I believe, is to be sure that everybody knows this is a crisis of public health. It's also a crisis of equity because it affects people in communities and countries who are less prepared, more marginalized, and under-resourced. It's really important. So when you start thinking about climate and health, of course, you can say these things are coming together, but they really are one. But climate involves so many different aspects of it. When I think about the sectors involved with climate change, about transportation, energy, food, you name it, and there's a long list of them. most of the planning around these are what I call vertical. In other words, each economy has a model looking at consumptions, emissions, and look at what can we do on mitigation, innovation, and adaptation. Very little about the impact on health. In fact, I'm not even aware of any of these initiatives or global efforts looking at, if we do this, what would happen in health, right? So the question about intersection is really important when you talk about different sectors, because first of all, most of the policies and decisions are made in the context of a sector alone. But importantly, when we recognize that all these sectors converge, that is agriculture, energy, on human health, that I think the current economic model doesn't quite work. So my feeling, our work at the Academy, led by Judy Roden and Andy Haynes, is to look at a systems transformation, right? How do you actually look at existing models, and how do we actually change the thinking whereby these things are brought together in a more systematic way, holistic way, to look at the impact on the health as well altogether. So that's what we're looking at.
That's fantastic. I think it is going to take a multi-sectoral response to do something meaningful.
Sure.
Yeah, thank you for that. Climate change, as we've talked about, is clearly affecting the spread of disease to multiple regions. So estimates are that there will be over 1 billion people newly at risk by 2080 of dengue, chikungunya, and Zika, not chikungunya, and other arboviruses. So knowing that, we need to be ready to respond. And pharma has a crucial role to play in enabling that. So turning to Paul, what can you tell us about what Sanofi is doing to prepare for the health impacts of climate change? How are you preparing to make vaccines and therapeutics available where and when needed?
So there's a very deliberate and broad response from the industry, actually, but to focus on us for a little moment. You know, my own journey on climate and health basically came out of, I've been in healthcare for over 30 years, and then I got very interested in climate and the impact it had on health. And now more recently, working with a small group for a group that Prince Charles set up when he was Prince Charles, and the SMI, the Sustainable Markets Initiative. We've been working very hard on the fact that if 5% of global emissions are health, and 45% of that is delivery of healthcare, what can we do to decarbonize the delivery of healthcare? Surprises people sometimes because you know, a lot of those emissions are overheated hospitals, or driving to a hospital for a visit that could have been done virtually, or you know, the incidental costs on emissions are pretty staggering, frankly. But the bit that we're really focused on as a company, where we can do, I think, a lot of good work before I get to vaccines, is, you know, if you're an average adult, you'll create around 15 tons of carbon, 10 to 15 tons of carbon in your adult life. If you're pre-diabetic, you'll also create about 10 to 15 tons of carbon in your adult life. If you go on to be diabetic, you'll create between 30 and 45 tons of carbon, because the way healthcare is delivered to you, medicines that are made, transportation to a hospital, caregivers getting to a hospital, it's almost 3x. And so preventative health, helping people not make the journey from pre-diabetic to diabetic, for example, can have a simply mind-boggling impact positively, not only on them, but on the climate. And I think we've always, in our industry, we've always looked at it in reverse, which is, you know, air pollution causing respiratory disease. It's still very valid. But it is interesting to think about disease prevention. Vaccination is a big part of that. We're one of the world's leading vaccine companies, and I can tell you we provide vaccines at little to no cost in almost all countries. In fact, we are working even harder on helping provide places of care, which could be at places of worship in some of the hardest hit countries, because where people gather is where we can try and do some good, because we can't expect sophisticated healthcare delivery systems in cities in many of these countries. So we work tirelessly to try and make sure that we can bridge that gap. The last thing is about our own emissions ourselves as a company. And, you know, we've committed to net zero by 2045. Like many, we've committed to neutrality by 2030. We've committed to 100% renewable by 2030. You know, we've worked across all the levers to try and make sure that we're not adding to it. And as a CEO, I have to say, when you get these roles, you know, it's exciting, of course, and you think about transforming your company, great. But I think more and more, particularly with the times I spent at Davos, you realize your responsibility to use your role to do good for the planet and population health like never before. Mm-hmm. And I've been coming here a long time, but just simply changing role over the last 3 years for me has been, a real moment of truth for my own role in trying to bring all those things together to do something significant. And if we don't, nobody's going to.
Mm-hmm. Yeah, I think that's right, like never before. I mean, leaders, as has been said here this week, leaders are having to step up in a completely different way, at a different level, to address these intersecting challenges. Yeah. In order to roll these things out, we're going to need robust health systems and workforces. So we need the right skills and capacity globally. So Vanessa, what do local health systems need to prepare and manage for these kind of changes?
Well, I mean, I think, first of all, it's lovely to see everyone and to have this discussion because it is critically important. And we think a lot about communicable diseases being led to, related to climate change. But the truth is non-communicable disease is being driven by climate change too. In fact, air pollution is the second leading cause of non-communicable diseases globally right now and the first in Southeast Asia. And when you think about what that impact looks like, that's actually about 47 trillion in costs globally between 2010 and 2030, just to manage some of that disease. And so as we're looking at this, it affects every aspect of health. There's higher maternal risk that's led to from climate change, increases in stillbirths, premature births. So we're seeing this impact across every sector. The malnutrition, every aspect of health is being impacted by climate change. But what that actually relates to, ultimately then, is every other sector at the same time too, because that is our security. If a mother dies, her child is more likely to die growing up. Their child's more likely to be socioeconomically disadvantaged. They don't go to school. When you think about what most people's main assets are, it's their ability to work. And if you're sick, you can't work, you can't participate in markets, GDPs don't grow. And so we have a real opportunity to address this. A quarter of the world's deaths currently are from preventable environmental causes. So if we don't tackle this issue in this nexus, we're really setting ourselves up for a much harder pathway. And I think as we think about what the solutions are to address this, and it's really in building strong, resilient health systems that can address all of these diseases. And for me and for the work that we do at Seed Global Health, that is very much rooted in health systems and the health workforce that makes up those systems. Mm-hmm. We've done an incredible job of promoting technology and trying to leapfrog, these solutions. But we are actually leapfrogging the fundamental people who are needed to deliver care. Mm-hmm. And it doesn't mean that there isn't a need for technology, but you leverage it through the humans that hold it, know how to use it. And when a woman is in preterm labor from extreme heat, and she's hemorrhaging, it is a human who hangs the bag of blood that will save her life. And so we have to really think about what these connections are. Dr. Ahmed, I'm really glad that you raised Malawi. Malawi has the largest cholera outbreak it's seen in 20 years. There's been 25,000 cases, and it's all being driven by the climate changes, the cyclones, the environmental hit to the communities. This is a country that is already struggling with many other health problems. President Chakwera of Malawi wanted to be here in Davos today to try to seek private investment to grow his country, but he's home dealing with this domestic crisis, which is now seeing 500 new cases a day of cholera. And that's happening as we're all sitting here in Switzerland. And so there's a really real crisis of where we're going. But we do have the ability to make these changes. And in fact, it's actually cost saving. So we invest in a health workforce, and we invest in this resilience. We invest in addressing this problem. Actually would lead to about 4.4 trillion in GDP growth for these countries. That means there's a $2 to $4 return on investment for every dollar invested. So we have incredible capability, but it comes down to very simple things. It comes down to political will. It comes down to mobilizing finances. We just have a fundamental financing gap that we're going to have to close. But if we do close, we are going to see the savings at the back end that can be quantified. And far more importantly, we're going to save lives. and create a better well-being and a better security for all of us.
Thanks. Yeah, we have to take action early, and I think we saw this in COVID, right? So COVID cost us $11 trillion over 9 months, right? And we knew we needed to do more on global pandemic preparedness, right? So now this is staring us in the face, and it's time to take action. The issue about food security, the IPCC report also talks about the reduction in land that's suitable for farming due to extreme drought. There's a reduction of about 30% since 1950. 30%. So we're seeing growing hunger. So the heat waves in 2020 were associated with almost 100 million more people suffering from food insecurity than in decades past. So this is one of the key ways that climate change will affect health, is through food and water supply. So as we've said, many regions are experiencing this right now. It's not in the future, it's right now. So turning to you, Kathy, so how is UNICEF seeing climate change affect health in children's lives in particular?
Well, if I could just put it in a little perspective, we've seen over the last few decades some real progress in children's health, related mostly to vaccines and to sort of lowering child mortality, and it's been impressive to see that. But I think we're seeing climate as a real threat to that, and for several reasons. One, as you said, these heat waves are incredibly damaging to children. Their bodies, and Vanessa would know this better than I, but are susceptible to this. They're more vulnerable to this, and it's hard for them to deal with it. We're also seeing these patterns of infectious disease. Malaria is something that we're very concerned about for children, and in part because of COVID, we've been less able to do some of our more routine vaccines, so it's just adding to this really difficult situation. The droughts and the water insecurity are really challenging for children. I saw it in Ethiopia. This land is so dry, and it means that these children are literally wasting away. We're doing a lot of work trying to deal with severe acute malnutrition. To see it is something that really is just heartbreaking. And you see first the animals, waste away, then the children start to waste away. And what happens then is the populations start to move. We end up with more conflict and challenges like that. So really difficult. And I think, we're seeing so many children who have no idea where their next meal is coming from. I saw it again in Yemen, where children are just literally so vulnerable. And all of these climate threats, everything that happens in the world, every bad thing that happens is a little bit worse for children, and that's what we're seeing. So we see the climate crisis as really a child health crisis.
Yeah, no question. One of the other 4 pillars of Wellcome strategy is about mental health, and we focus in particular on young people and looking at what's happening and trying to intervene early. It sounds like you are seeing some changes in mental health among children.
The interesting thing is there's more awareness of mental health issues. That's a positive. But we also know that the impact of so many of these crises is having a real damaging effect on children. I've seen it in Ukraine, where these children are talking about seeing horrible violence and the impact of that on children. I saw it in the DRC, where I met this young boy. It was just something that stuck with me, because he was talking about having seen just horrific violence where he saw his friend killed in front of him. And it was a sad story, but not unlike other stories I'd heard before. But he was such a profoundly sad child. And afterwards, I found out that not only had he seen his friend killed, he had seen his friend decapitated. So for children to try to figure out how to adjust to things like that is really difficult. For UNICEF, we're trying to address mental health issues, and we're providing psychosocial support where we can. It's not easy. If you look even in my country, in the United States, it's not always readily available. In other countries, you can imagine how hard it is, but we're trying to incorporate it into our more general health response.
Yeah, I think we've talked about a lot of things that we're seeing on the ground, that we're seeing every day in what we interact with. But what I think we need to do to make progress is to make this real to those who are setting policy, who are setting policy for adaptation and mitigation to climate change. So for anyone on the panel, what can we do to make this real, so that policymakers, when they consider action to address climate change, consider the downstream effects on health? Victor, yeah.
Well, there's certainly not enough work done in research in climate change and health. Actually, it's very little. Most of the evidence are associative evidence. As has been discussed, there's air pollution, leads to 700,000 deaths. Therefore, it's climate change. And so we need to do some serious research in linking climate and health outcomes, providing the evidence. That's absolutely clear. But I think that's simply the beginning. So as we can all imagine, we learned from COVID that how poor data is being collected in the United States or globally. And so it's really difficult to know who's affected, how's it being affected, and what's the outcome. So I think a kind of a data network is absolutely necessary to do a systematic collection of that information, particularly in the poorer countries where they have the most affected and the least emission, if you will. But I think there needs to be more action-oriented research to say, what do we need to do, or what are the interventions that it will result in any evidence is better. I think the policymakers would be willing to listen to those issues, right? We've told the narratives and data to say it's really hurting people, lives, but here's what actions needs to be taken. And these are adaptation and mitigation strategies as well as innovation, new ways to do things. I'd like to come back a little bit and also make sure I address some of Paul's comments, but I want to make sure my other colleagues have a chance to answer.
Great. I think Vanessa has something to contribute.
I fully agree with the need for research. I'm an academic at heart, and I think that's critically important. But I think there's a yes and there, because as much as we have to generate the knowledge and the information, there are actions we can take now that we know will create positive change and that we can support because it fundamentally can sort of be the right, or can do the right thing, if you will. And just to give an example, when I think about the problem of climate and health, and we're training workforce to help address the growing burdens of disease and all burdens of disease, prioritizing the ability to train, for example, it takes time to do that. We have to start that now, because to build that workforce that is going to manage the extra 250,000 deaths that we're going to see from climate change, the growing non-communicable disease, the existing disease that is already there, we already know that that's a win-win and we can be pushing for it. And we also know it's possible. So I think that if we can give policymakers already what some of the solutions can be and the answers and the fact that there's already partners ready and at the willing. And I think, Dr. Ahmed here is leading at the Africa CDC a huge initiative on the new public health order, which includes investing workforce and building out local manufacturing to help address some of the, the vaccine readiness for the changes we're going to see in disease. And being able to invest in those now when we know that they're also just going to have a good outcome lets us also get started on this. And I think giving those solutions that we know have worked by bringing examples like the work we've been doing at SEED in our countries in Africa, or the work that our other colleagues have been doing, or the countries have been leading on, can go a long way also to getting us started to adapt to something that the train's already out of the station on climate change. Yeah. We have to start action now.
I think, yeah. Let me go to Paul, and then I'll come back to you.
Okay,
yeah.
Thank you. Maybe a couple of comments. One is sort of the urgent. We have a foundation, Foundation S. We had a foundation as a company a very long time, but it felt like it was more for posters by the elevator, in the building. It didn't feel like it was really where it needed to be urgently. Right now we're in Bangladesh, and doing what we can helps establish satellite care centers, planning long-term mangroves and locations that are needed, and doing things that we see much more directly connected to the purpose of the company, and hoping to build those at the foundation into a business strategy so that it's everybody, every day, everywhere in our company is responsible for helping Bangladesh, even if you're not directly connected. So there's the urgent piece. I touched a little bit on some of the work we're doing. We're giving to the 40 poorest countries in the world the 30 most essential medicines, mostly for non-communicable diseases, at cost, just because we can and we think it's the right thing to do. But more interesting than that is we created a tech fund in Africa. We put 25 million euros in to get it started. And I call it frugal tech. It's perhaps not the right expression. I'll probably learn a real expression while I'm here. But it is, for most of the continent that's using first-generation cellular, it's tech innovated within the boundaries of what's available to help support healthcare delivery. So it's not trips to Silicon Valley thinking, how can we conjure up a new app on our smartphone or iPhone 14? It is tech-enabled initiatives and startups we're investing in the communities. We know banking happens on GSM. We know health records can happen there. We know communities can be built there. We find it very important to innovate locally, because everywhere else is effectively for show, to be honest. The last thing, and Victor and I have talked about this a little bit too, and maybe he's going to touch on it, which is we went to COP27 to try and affect policy change. We went to try and say, in our world of delivery of healthcare, decarbonizing the healthcare journey requires data, radical amounts of data, publications, policy updates, open-mindedness, multi-stakeholder progress, patients themselves to be aware about the journey from pre-diabetic to diabetic, but also what it's like in the cities of the future to try and take the carbon piece down in your delivery of health. If we learn nothing, maybe last comment, the US insurers in the pandemic reimbursed virtual visits to talk to doctors. This is the US, right? Should know how to deliver health. Reimbursed virtual visits, right, through your insurance plan. As soon as and patients liked them, they could do more of them. As soon as the pandemic was over, said they were no longer reimbursing virtual visits. You had to go in person because there was too much sunk cost in infrastructure. Instead of a blended approach even, which would have been better for the environment, making everybody get in the car for a routine consultation. It's like, how crazy is that? We have lots of work to do on getting people into the spotlight and working on policy.
So I think that points to something else I'd like us to touch on, which is, how can we listen to the priorities that are locally derived? Because each environment is different.
Yes.
So let me, we're rapidly over time. So let me go quickly to Victor for his comment, and then maybe Kathy, you can reflect on that a little bit.
First of all, I want to agree with my colleagues strongly, and certainly with Vanessa's and. But that being said, I want to be sure that we think about the bigger picture, which requires not only the health side to change the equation, the way to do things, but globally. As I said, the other sectors have to understand, government understand this is all about health as it relates to all the other sectors. But back to Paul's point, globally, health sectors emit 4 to 5%. United States about 8.5% of all carbon emissions. It's an important percent. But we look at healthcare and many of the innovations that Vanessa talked about, it's still a very small piece of what we're dealing with, right? It's absolutely important because we as health professionals, myself being one, need to really think about this as part of our mission, right? When we think about caring for the patient, looking at how to do the best we can, we have to now take the environmental equation into the issue. And so all our healthcare workers should be trained in this whole issue of understanding climate and healthcare. And our initiative involves all the education, medical school, et cetera, in doing this at National Academy. But importantly, what Paul was saying is bringing together all the sectors or the subsectors in healthcare. So the private industry, SMI, and we have a similar one that I work on with the Biden administration. It's co-chaired by Andrew Whitty and George Barrett and the Assistant Secretary, like how to decarbonize the U.S. health sector. I mean, back to this point of waste and telehealth, energy consumption. I was looking at this data. One hospital in the United States generates as much waste as 93 hospitals in eye surgery in India.
So that's a great segue. I'm sorry, I'm going to cut you off because I know we're already over, so apologies.
No problem.
But maybe we can talk about looking at local context and local priorities and making sure that we're addressing the most urgent needs based upon what's going on in country.
I would say, for us, there's a big picture here, which is obviously there are leaders who need to do better by all of us, right? To reduce carbon, to help countries do better with that. We in UNICEF are dealing with the consequences of it. And so what we see is really at the community level, the most important thing we can do is support community health workers, doctors, the people that Vanessa trains, because they are there, they're dealing with these problems in the front lines. They're the first people who can identify what's happening, try to help remediate the problems. But we're always just trying to fix something here. And this is a problem that children did not create and children suffer the most from. And we all need to do better. And I think if we can advocate in all of our sectors, remind everybody this is an important data point in the broader discussion about climate, that it's affecting everyone's health. It's really affecting children's health. And what does that mean for the future if we can't get hold of it?
Thanks. Yeah, that brings us back full circle to what Dr. Ahmed said in the very beginning about solving for systems that need fixing, right?
Yeah.
So great. This has been a fantastic discussion, and I'm sorry to not let you.
I think designing research is exactly the point. I think many research is not designed with the community in mind. People with lived experience participating in looking at where the issues are, where the needs are, and how to co-design the research questions.
That's great. So we have just 5 minutes for a question or two from the audience. So it may only be one. But if I could have somebody take a mic to this gentleman right here, please.
First of all, thank you. My name is Roman. I'm from Ukraine, and I'm from Global Shepherds community. And also, I'm an anesthesiology resident from the biggest hospital in the Ukraine. And you know, in 2022, we faced the biggest war since World War II, and our healthcare system challenges has extraordinary challenges: severe blast injuries, post-traumatic stress disorders, mental health problems, insufficient nutrition for newborns, antibiotic resistance, because when we have trauma, we have a lot of trauma, we have a lot of antibiotics and so on. And these challenges that the best specialists in the world should work on. And what is the best way how the world could deal with this and help? Thank you.
A challenging question. Who'd like to respond?
I would make a general point, which is war is the worst enemy of children everywhere. I mean, we see it in every conflict. They suffer the most. I saw it in Ukraine where people were operating in hospital facilities underground. I mean, it's just, it's almost impossible to have a good outcome in a situation like that. So, I mean, I would advocate for the end of war if we want to try to do well by children. And certainly Ukraine is a good case example of that.
Certainly, I think there's lots of effort, at least when I can see, and on behalf of our academies, reaching out to not only Ukrainian scientists and clinicians, people on the ground, but also to the neighboring countries like Poland, where you can see a lot of displacement. So we have major initiatives to look at how to support looking at on the ground, working with the Ukrainian health systems, et cetera, and trying to raise a lot of money and enable also students who displaced, who go to Poland to continue education. So I think your point's well taken.
I think that there's you outlined for me the real crisis for the health workers that are on the front lines, that are putting their lives at risk every day to take care of patients. And that speaks to a broader issue of how we value healthcare workers, I think globally at this time, and the kind of investments we were putting in it. And I think there are a lot of institutions, or I hope there's a lot of institutions. I know Mass General, where I am a physician, has been doing work to support some of the acute care needs through either telemedicine, directly sending support teams. I think the degree to which both your government, but also your professional societies can make connections with other professional societies outside of the country to be explicit about what the needs are, we can then, as a community of health workers who want to stand in solidarity, can try to motivate both the resources, the support, the expertise, and think about where there's lessons learned in other times of conflict, crisis. I think a lot of blast injuries, also there might be lessons learned from the giant earthquake in Haiti and the crush injuries we saw, and how we figured out systems to be able to take care of mass casualty. But I think there's the solidarity piece. There is a community that wants to support, and I think we can make those connections to really try to reinforce the extraordinary work that you all are doing every day on this front line, and to know that there's many ways that we can mobilize the resources that are in existence, and we will continue to try to do so.
Thank you. Anything?
Well, only that, I mean, it is awful in so many ways and brutally tragic, and we know that. And for us, the first order of business as a healthcare company was to make sure that the medicines could get through. There was over 33 checkpoints. Often our trucks had to get through. Our distribution centers were damaged. our staff in the centres that we're distributing to hospitals, which were already severely structurally impacted, the staff had gone to fight. So we had to retrain people and get everybody in the right place to make sure the medicines could get through. No different, by the way, to any other pharmaceutical company. I think everybody kept trying to do it. I think the real step up from us and others will be the rebuilding effort and how we help retrain, how we help set up new infrastructure, what we can do. And there's been many connections with the Ukrainian government on trying to get that started, planning for the, for the return, if you like, which I know feels hard to be optimistic about it today, but I think it's part of our duty as a healthcare company to play a part in that. And I find that the requests from the Ukrainian government and representatives have been very considered and very long-term in their planning. And I think we have to remember, once hopefully this thing is over, as awful as it is, that we don't forget the urgency in the reconstruction, which I think we all have to play a part in.
Thanks, Paul. And I think this underscores how challenging it will be to keep health at the forefront of our climate action, because there are so many other competing crises that we need to take into account right now. This is the challenge that we all face. So if there's anything that we've learned from COVID, though, it's that there are reasons to be optimistic, right? So we've seen that when we come together, when we bring together industry, government leaders, civil society leaders, together we can find a way forward. As we consider the development of adaptations and mitigation around climate change, we have to keep health at the forefront. If we do, we can ensure health and prosperity for the long term. If we don't, we will, I forget who it was, I think it was Kathy who said, when people can't work, when they're not healthy, they can't work, right? So it will start to tumble one after the other more rapidly than we'd like to see. But we can do it if we come together. So thank you so much to this panel for a really exciting and stimulating conversation.
Thank you for the moderation.
And now I'd like to turn it over for one moment to Shyam Bishen, who has a closing comment.
Yes.
Oh, there you are, sorry.
Thank you, Cheryl. Enough has been said, so I don't want to take up a lot of time rehashing those. But the one thing I want to emphasize is the impact of climate change on health is here and now. It's not 5 years from now, it's not 10 years from now. So we must come together and take action now. We have seen that with rising temperatures, more than half of the infectious diseases are increasing. Mm-hmm. There is a big increase in those infectious diseases. Over 20 million people are being displaced every year with rising heat, with flood, with drought, with all kinds of things. So those are some really sombering numbers. We see the WHO is projecting 250,000 deaths every year because of the direct impact of climate change on health. $2 to $3 billion losses every year because of that. And this is just the direct cost. Indirect cost is obviously much more, much more than that. So that time for action is now. And the answer is, as you said, Cheryl, multi-sectoral action.
Yes.
People from different sectors have to come together and act on it. The answer is in global public-private partnership. And we at the World Economic Forum, as you know, we pride on providing that platform. So that's something that we pledge today. And actually today, the World Economic Forum, together with Wellcome Trust, will launch an initiative to look at that, launch an initiative that is to look at the impact of climate change on health. As Victor was also saying, we want to make sure that there is, and I think Vanessa said too, that there is enough research-based data, research-based evidence. So but we want to collect that, and I think Wellcome Trust is already doing quite a bit of work on that. Other people, our World Bank and others, are also collecting information, but it's not in one place, and more needs to be done. So we want to make sure that we have good amount of research-based data that we can take to policymakers. We can bring it all together to respond to it. I mean, the one thing we need to do is prepare our health system. If we want to tackle the impact of climate change on health, your health system has to be prepared. It has to be sustainable, it has to be resilient. So that's something that we would be working on. But with that, without taking any more time of you, I want to thank Cheryl, Kathy, Victor, Vanessa, and Paul for being here, and all of you for participating in this. Thank you.
Thank you.
That's great, Cheryl. I'm glad you